Huh. How do I do that? Start video? No.
Yeah, it's in the bottom left corner next to where like the speaker is. It'll say start and stop video.
Got it.
There we go.
Yeah. Now, are you actually showing this, or are you just using this and then you're going to present something?
So it says that your camera's off again.
Yeah, it just went off. That's weird.
There it goes. So for like usually in the past we would pick two professions and like instead of doing exams like midterms, we would go and shadow two professions for the entire week and then we give a big presentation to like our school board and everything. But this year since of COVID and everything, we're not allowed to shadow people, so we have to pick four professions and we Zoom them. And then like this recording I send to my English teacher and then with all my four Zoom recordings at the end, I like combine like a short like 5-minute video or something, and then
Yeah.
I
So,
it.
yeah. So you're going to actually show. Do you want me, like, I've got glass in the back. Do you want me to go to another room?
Oh no, you're fine.
You're okay?
Yeah.
Okay. I did my hair just for you.
Thank you.
I realized today I probably haven't brushed my hair in 20 years.
I mean, that's a lifestyle. I wish I could do
I
that.
know, that's what I'm saying.
Usually those days I just go to school with my hair in a ponytail. So
And Andrew takes an hour and a half. Yeah.
yeah, usually I have to wake up early, but I
And
can't do that.
how did you choose this topic?
Um, I was thinking about like I know I want to go into the medical like field, but I don't know exactly where yet. And so I'm trying to just like I did a chiropractor as my first one. So now I'm doing you, and then I'm gonna figure out my next two. But like we do like a Zoom meeting every month. So like it kind of gives me like a good time to like figure it out.
What about the pediatric orthopedic surgery thing?
I'm like interested in that, but I just like I don't know. I'm like I think I'm gonna Zoom one of my like someone that my dad knows. He's a orthopedic surgeon, so I think I might do him. He lives in Florida, so I
Mhm.
probably will do him next.
Okay. No, but and is the goal of this to, are you sort of seeking reflection and wisdom from certain physicians or like certain healthcare people to help you figure out what you might want to do? I mean, I like understanding the audience in a sense. Is that kind of the gist of it?
Yeah, like this is what it's all about. Like usually we would go like how I said and shadow them to see if like we could see like ourselves in that lifestyle and like doing that line of work. So this is kind of a little bit trickier since we can't actually like, shadow you guys in person, but we ask like everyone certain questions and stuff to figure it out.
Okay.
So my first question here is where did you attend college and what is your degree in?
Well, my name is Dr. Scott McDermott, as you know, JJ. Thanks for asking me to participate. I grew up in Eastern Canada, so I went to Dalhousie University and did all of my training in Halifax, Nova Scotia. I graduated, it was 1985 from medical school. I won't go back further than that. And I finished my urology training in 91. And then I went to Duke and did a fellowship. And then a couple of years after that, in 92, 93, I went to New Zealand, England to do more subspecialized training as a urologist. And then I immigrated here in 94.
Oh wow. I didn't know that you had done like all of that. That's actually really cool. And so my second question is, did you go to graduate school and was it necessary to?
Yeah, well, that was, the graduate school is part of the urology, or I'm sorry, medical training, because it's a long haul, especially if you specialize, and then even if you subspecialize. And medicine and when it comes to the human body is almost endless on how much you can learn, but it's just a necessary sort of part of the journey of your education. I think I was 34 when I first started working, and I think after high school I went another 14 and a half years. So it's a long time. I think probably to be a family doctor now in the United States, I'm still thinking it must be 9 years, maybe 10.
Very interesting. Um, my third question is, how did you find out about this job?
Well, for me, it was I grew up in a little town called Moncton, New Brunswick, and I can just remember walking to Besborough School. I don't know how old I was. I don't know, grade 2, grade 6, and but from day one, I've always wanted to be a physician. My dad was a dentist. No one else was in the healthcare profession in my family. But looking back, I was one of those lucky persons that just knew that that was your calling or your purpose. So that's it worked out really well for me. I think others probably go into medical school because they like science, they like biology, and much like whether it's teaching medicine or other things or being a parent, helping others is just something that you're drawn to do as opposed to maybe selling something and or working in the business field.
Yeah. What made you want to like specialize in being a urologist?
Well, it's funny. I was in the Canadian training is pretty vigorous, and I remember sitting in class. We'd have, I'm doing my basic training. I'm in second year, and part of second year, we had 40 hours of urology. That was a urology block, and of course, there may have been 80 hours of cardiology. So these are things that you're learning, and I kept saying I kind of like this stuff. I sort of like I like the topics, whether it was kidney stones, kidney cancer, leaky bladders, and things. It just you can't help that if you're more interested in something. Then when I in fourth year and then internship, you could get rotations. So I chose urology as one of them. I was like yourself. I wasn't sold on that I want to do, but once again, because it's almost like a personal relationship, you're not sure why your heart is drawn towards one thing over another. I think sort of a typical answer is urology is a really good combination of medicine. You're in the office helping people with medicines and different things, but also surgery, and it can be pretty complicated. And then we use a lot of telescopes. It's called endoscopy or minimally invasive surgery or procedures. As you've been exposed to orthopedics, and it's very heavy on the surgical side. Your week is really in the operating room a lot. Ours is a more balance between office surgery and these endoscopic procedures that are done in the operating room or in the office.
Oh, so you get like a good like mix of both. It sounds
Yeah,
like.
it's a good blend. I mean, I enjoy that myself. I kind of have a little bit of an orthopedic personality, if you could sort of say there's certain personalities that fit things, but it was just too much surgery for me. I just did not want to operate that much all the time.
Yeah, that'd probably be a little stressful. That's why I'm like, okay, I'm just gonna look at like a wide variety just to like, kind of figure out.
Mm-hmm.
And would like, do you remember what a starting salary looks like in this line of work?
Well, in medicine in general, you think about it, you have to sort of, because the number I'm going to give you, I think is high, but I think you have to take it into context of you start after 10 to 14 years of extra school, and the amount of hours you're putting in a week, you can almost maybe double those years in true hours relative to most other professions and the amount you study and work. Now, but I would say probably as a physician, your starting salary is between about 150,000 and 400,000. That would be sort of the range, depending upon what you choose, whether it's pediatrics, whether it's orthopedic surgery, whether it's urology, what have you. The higher end is the ones that tend to be a lot of wear and tear, like surgery. It also tends to be higher when you're hired by a healthcare system, which is now employing a lot of physicians, so they have a lot of money to attract people. But what you start with is pretty close to sometimes where you finish. Probably as a general rule, let's say you start at 200,000, probably the upper edge on all of these numbers is maybe 30, maybe 40% higher, but probably 30% higher. So where you start is kind of getting close to where you're going to be.
I never knew that it was kind of like, I guess like managed or like seen as it that way.
I'm sorry.
I like I never like thought of it that like kind of where you start isn't very far from like where you could end up. Like, does that make sense?
Yeah, I mean, in private practice, we have to pay our own bills. So we're hiring urologists, but we have to compete with others that are offering salaries. But like my two young partners that just became partners this last month, they're going to notice that their income doesn't go up a lot more when they become a partner, as opposed to maybe in the law field where they pay you, for instance, I don't know, I'm going to choose a number, $100,000 for 4 or 5 years, and you're sort of doing a lot of work for the partners, and it may jump to this enormous number or not, but quite a pretty healthy difference as a partner. That doesn't happen in medicine. Now, if you're joining a healthcare system, let's say, that owns their urologist, let's say, what you start at is probably exactly what you will finish. I mean, they're paying you what's called a work unit, an RVU, a relative work unit. So let's say they pay you $50 an RVU. Well, they're paying the people who've been there for 10 years $50 an RVU as well.
Yeah.
So what you start is where you finish. That's a good or bad thing depending on how you look at it.
Yeah. I guess everyone would have like a different kind of like viewpoint on that.
Yeah.
What is your favorite thing about your job?
Well, I think it's there's a lot of joy, whether it's with medicine or surgery or just speaking with your voice to a patient. I think we take it for granted, but when you help someone else, that's pretty, it's pretty, that's probably my favorite. Unfortunately, in the kind of the battle of every day, you don't necessarily think of that, but your question made me think, and I think that is my favorite. I do like, oddly, I'm very subspecialized. I look after leaky bladders in men and women and what's called pelvic floor and bladder reconstruction. It's a very narrow part of urology, but oddly, I just love that as a job. And I can't imagine if I didn't. I think, oh Lord, this would be tough. And then I've been in academics forever. I do really love speaking and research and consulting and the education side of it. That's by far a lot more fun than the daily clinical practice, but that's just me.
What would you say is the most challenging thing about your job?
Well, it's really the daily grind and stress associated with medicine. I would say it's pretty fatiguing. I think even my youngest partners would say that, especially mentally, but also physically. I mean, sometimes it's tough, especially as you get a little bit older. It really has become somewhat of a grind, let's say. I've made some little notes here to help answer your questions. What's happened is medicine has sort of become a commodity where, much like education has in this country, the patient is the customer and the doctor is there to make them satisfied. And a lot of physicians now are owned by healthcare systems, and really just sort of fulfilling that goal and responsibility is probably the part is quite challenging. And it's not nice to tell it, but you need to really realize this. The way when things have become sort of a service industry as opposed to this, a doctor to a patient. In this case, you're there to keep a customer satisfied. There's a level of sort of, many of us feel there's a devaluation or a disrespect. Even you feel that way, whether you're a teacher or a physician, that one can be pretty tough at times.
Yeah, I bet it is. Like, I can't say that I've experienced it, but like it sounds like it'd be really hard.
Well, I think that what you could at your age, I think if you felt about the teachers that that take teaching you and caring for you and thinking about JJ and really want you to learn, whether it's a student or a parent, or I'll leave it at that, they can feel devalued or disrespected and sort of lose their voice. And when you take away that kind of that relationship, it kind of it can be tough on people.
Yeah. That's why I like going like just to like kind of bounce off that like this smaller school because like I know our teachers care. And I bet Lindsay feels the same way because she goes to Caldwell and it's kind of like the same size. But like our teachers are so like involved with us and like we're involved with the teachers. So like we get like that good balance between so it's like 50-50. Like we both know we both care.
Well, I think that's probably, as a Canadian, I've not been, we only have Lindsay, as you know, and we haven't been in the public school sector, but I do believe, I think public school teachers may get paid better. I don't know, but that was my impression. But I think people are in the smaller private schools because it's selecting someone who does, care a lot about their students. It doesn't mean they're not in the public sector, but I think it is constant a lot in the private that's why they're there.
Yeah, like when I talk to my friends that go to public school and like we'll talk about our workload difference and like mine is a lot higher than theirs and like my classes are harder. So I don't know. I'm glad that I'm in a smaller school because I like getting that like kind of one-on-one and you get that relationship with the teacher.
Yeah. And that, I know that's why, Lindsay, is I think she's going to do well, like yourself, or the colleges you're going to. It's the same sort of feel.
Yeah. I would ask you what is the most rewarding thing about your job, although I feel like that'd be kind of similar to your favorite thing about your job, unless you have
Yeah.
anything you would like to add.
Well, I think the most rewarding is doing what you're sort of being called to do. And I sort of, have thought about this a lot and sort of write about it and things, but, sort of living out your purpose. And I do believe that physicians and people who serve in this care, healthcare providers and physicians, I believe God's given them gifts and talents to help and serve others. I just believe that that's in their gene code. It's their purpose. It's their why. And when no matter how hard the day gets, when you know that that's what you're doing, it's sort of mission that's very fulfilling. I don't know how, with the stress of medicine, if that wasn't your foundation, at least for me personally, that would be more challenging. I think as you know, I'm a believer, but I do, whether it's from within or from a transcendent source, I think sometimes even the more difficult the task is, in this case, working in the pressures of medicine, that, almost the harder it is when you try to take on that journey and that responsibility. It's actually a pretty good formula. You end up, whether you sort of win, lose, or draw, that you really feel you've met, you're fulfilling your life's journey. And I think that's what's most important. I think I've known your folks and you now for 4 or 5 years, and JJ, I do think that people are called to medicine, and I think you're one of them.
Aw, thank you.
Well, I don't think it's one of those. It's sort of like you can run, but you can't hide. Your soul will know where you are. It will track you down. So whether it's nursing or this or something else, I do think that people, especially as you get older, when you're living out your purpose, it makes it all worth it.
Yeah. My parents have been talking to me a lot about like, going through the college process and what I like want to do afterwards. And they're like, you'd be like, I've like my goal, like I really want to do something with pediatrics because I love kids and like, I don't know. Kids just have like this weird like connection to me. Like they just always
Yeah.
come up to me. So I just like feel like I should go and do pediatrics or something. So I feel like that's kind of like
Well, I think the difficulty with medicine is it really takes so much of you,
Mhm.
time, emotionally, mentally. Now you can let any job do that, but medicine by definition really, it's pretty demanding that way. And especially when you want to live a more balanced life, because I think true joy and fulfillment would come from that. And if you want to be a parent and raise children or what have you, it's a little bit of a challenge, I think. But like I say, I do believe that deep down, your your calling will find you. And if you kind of use secular brain and kind of go through the do's and don'ts, and you end up saying, well, the hours are good and this is this, but you really want to do that, the other, it may not have been the best choice. If you can kind of blend the two, because I'm not trying to minimize the importance of, you know, having a more balanced life is really important. Like, I'll give you an example. If I was going into medicine, which I think many people are called to do, if you could not do surgery and take call like I do, I would highly recommend it. If you like another part of medicine versus the commitment of a surgeon being on call and the stress of the outcomes, and you'd be equally content, let's say, doing another discipline, that's where I would go. It's almost like I like two types of ice cream. We'll take the one that I think will allow you to be more balanced. Does that make sense?
Yeah, it does.
Yeah, you don't, it's not, and be careful of the excitement of the job early on. What I call the great case is not so great. You know, the trauma case with the orthopedic surgeon, and you're helping this person, the car accident maybe isn't as exciting when you're 55 and it's Sunday night at 3 a.m. So just be careful.
Yeah. My dad's out by like probably 10.
Yeah.
So yeah. My next question is, what are some essential basic skills like personality traits that are necessary to have if you want to work in this profession?
Well, it's like I said, I thought that was an interesting question because I think your dad knows, but I've written a book for people like you. Hopefully, you know, it's on physician burnout, but it's really to try to find joy and fulfillment in the profession of medicine. And one of the chapters is exactly, you know, I've learned from others. I'm not an expert in this at all, but it's really looking at personality traits. It may match you to being a good physician or not, or a fulfilled physician, I should say, and also one that may be more predisposed to the pressures and the burden of medicine. And what I've learned from others is that there's really 5 main personality traits. There's different degrees of extroversion. So you and I are more extroverts. You know,
Yes.
conscientiousness is really so let me just list them as extroversion, conscientiousness, agreeableness, neuroticism, and openness. So the extrovert is the person who likes to be around people, like a physician in the hospital. Conscientiousness is the hard driving, excellence is important, I'm very dependable, rules matter, you know, I'm going to get the job done, the buck stops with me. Agreeableness is you actually care about other people, you put them first, you're compassionate, you're listening. And then neuroticism is not, you're neurotic, it's for the same level of stress, you worry a lot, you're anxious. And then openness are the inventors and the musicians and people that think differently about a lot of things. Well, you can imagine how being very high in agreeableness and compassionate and very conscientious, and the buck stops with you and you drive excellence, would make you a very good physician. If you want me to explain it, I will, but if you think through it, it can also be your worst enemy in the current commoditized healthcare system, where excellence is no longer as important. And if someone isn't speaking to you or treating you well, that does hurt an agreeable person's heart, actually, just like your teacher. If they're trying to love on you and they care, and you're, let's say, you know, for instance, you may be arguably disrespecting them.
Yeah. I didn't like when I asked my first profession, like the chiropractor, about like personality, she didn't like give me that much like in depth about it. It was just more just like being able to be well with like people and like hands-on type stuff like that.
Well, I think you should, it's called the Big 5 personality traits. You should think about it. I've only learned enough about it so I could write and speak about it. I'm not an expert on it, but it's it's called the social sciences when you start, you know, about personalities, and the data behind it is one of the strongest in the psychology literature about how we're wired, and then how that can match your, you know, what kind of field you like to go in. You know, if you worried a lot, I mean, I think I worry. I mean, but but that could really hurt you as a, if you, that was a something you can imagine if every time you did a surgery, you, even though it went perfect, you couldn't stop worrying about it. You follow me?
Yeah.
If you're an introvert, which is equally, I mean, that's normal. You just have to be an introvert or an extrovert. But if you're an introvert, you don't necessarily want to be a surgeon necessarily, maybe around 200 people all the time, or in a healthcare system. You might be happier being a pathologist in, or radiologist, sort of sitting at your desk. Do you
Yeah.
get my point? You
Yeah.
see, there's not one is better than the other, but agreeable people tend to feel when they feel they're being, if the patient's not very happy with you and they want to let you know it, that can be tough on you. So your strength, but definitely the conscientiousness, the agreeableness, you've got to be type A. Well, that's conscientious, but hardworking. I think, um, I think a general term is the buck stops with you. You have taken this on, and this patient's excellence depends on you, and that's the bottom line. And you actually like that as a person.
Yeah. It kind of sounds like it's almost like kind of like in a challenge, because it's like you want to figure it out and like do the best you can to like put them in like the best like environment that they can be in too. Does that make sense?
Well, you're gonna. I know this is, and this is just, I guess, another way of putting it. Even though you do not think about it, the weight of that person's health is on your shoulders. It just is. That is, no matter how you look at it, it means you make the extra phone call. You go and look at the extra lab test. You double check this. You ask this extra question. You're doing all that. You know why? Because you have to. In you, you can't not do it. There's something driving you to do that. It will also drive you crazy in a sense. But the persons that are not that way are not the best physicians, in my opinion. This is the human body and not fixing a car.
Yeah. Big difference. What techniques do you practice?
What do you mean by, I didn't know what you meant by that, techniques?
So like I'm just going to use my last profession as like an example. For them, like they had like some people use like a drop table while others like don't, which is like, do you know what a drop table is?
No.
So it's like the patient's like on a table, and then like when they do the adjustment, the table drops. Or they can do like adjustments where it's like just like a regular table and they just do hand adjustments, or they can use like a machine to help them.
Well, see, I'm not really sure technique would be case dependent on surgery. So I'm not sure how it fits the medicine, but I guess
like, do you use a certain type of, like, you mentioned earlier that you use like a less invasive surgery now, like I guess that would be like classified as like a kind of a practice, so that like,
yeah, I think it'd be more the type, what you do. Techniques, I guess, let me look at it in a more different way, is you sort of need your circle of influence. You're in this world of healthcare, and there's a lot of pressure in keeping people happy. And as you can imagine, like a lot of workforces, not everybody's sort of driving excellence at the level that you would like. So you have your own circle of influence. So, the nurse that you depend on the most, the people in the operating room you depend on the most, the people that do, in my case, fancy testing and research, everybody around you that you're close to, you try to keep them, there's this team of influence or excellence. And then when you see the patient, you've got to see them quickly, unfortunately. But you've got to sort of demand, bring from them what's the problem, and then really try an efficient way to deliver their care. I think that's sort of very focused on trying to drive excellence in the job, but other sort of techniques is probably, especially for a young person who, some of us have to learn this the hard way, is there's sort of, again, from a psychological standpoint, to be fulfilled or joyful in your life, which is to me a lot more important than joyful and fulfilled in your job only. Do you follow me?
Yeah.
Is really 5 domains, and that's your job and career. And that's the one that medicine can take you too far on. It can just take you there. But it's your career or job, it's your family, it's your friends, and it's your community. And then it's your personal health, whether that's mental, spiritual, or physical. And when you can balance those and really set high, whether it's techniques or goals, or establish those in a healthy way, that's the way to go. And nobody told me that when I was your age. I think I've done well at that, but I would have been rather have been told. I probably could have, you know, I don't know if I would have done surgery. Do you follow me?
Yeah.
I probably would have, but that may have made me think, you're a young woman and you have a brain, and saying, if I'm going to put more emphasis on that, maybe surgery is too much for me. Or you follow me? Or maybe if I did plastic surgery, which is 8 to 5, I'm not going to be an orthopedic surgeon, which I also likes, which every fourth night I'm up all night operating.
Yeah, I understand what you're saying. And my last and final question is, what are some things that you have to be careful about while working with a patient?
Well, I allude to this already, is giving them, we're under, let's say I see 30 people in a day. Let's say I see 25, 30 people. Whether the patient realized it or not, it's actually very difficult for us to get those people through the clinic and sort of, let's say, help them as much as we can and drive excellence.
Mm-hmm.
If you look at all the moving parts and you're reading the chart and you're going in the room, but you may have only spent a few minutes with them. So I can see from their point of view going, what's this? I mean, he's in here 4 minutes, or other times it's 20. So it depends on the nature of the visit. But we're not doing it and then going out and kind of having a cup of coffee. If in other words, we can't spend enough time really like you'd want to. And I think so. You have to we're always sort of juggling that, and whether it's good or bad, I sort of keep things to business, meaning I don't do a lot of chit chat about your family and this and that. And like a cat doing, it's let's get on with it. But I think that is, that's a challenge. I think it's also challenging not to, and there's days I've gone home going, oh, I could have done a lot better, is not showing your fatigue or your stress or your burden to your patient. Sometimes your anger. I mean, the American public can be pretty tough on it. We can be tough on each other, and you just can't. You have to. It's almost like the teacher again. You have to hide that. You cannot do it, no matter how feeling you were right to do so. You can't do that.
Yeah, sometimes the teachers, it just kind of comes out at us sometimes, or it comes out at that one kid that just like won't stop talking, and everyone just is like, "Ooh."
Yeah, well, if you did that in healthcare, and I don't agree with this, it literally goes to not only the YouTube, or I guess, no, what do? You complain about people, chat online, but it could go to the North Carolina State Medical Board. And all you really did was speak to the patient like they spoke to you.
Yeah.
It's actually sad. But you can't, it's a one-sided relationship when it comes to that talk with that. They can be rude, they can be demanding, but you have to be nice. It's just, I don't mean that in a complaining way. It's just, but it's not easy some days.
Yeah, I bet
but most of the time it's great.
Yeah, I bet people like try their best to be nice. Like my mom's always like, okay, they're going to be under a lot of stress, so be super sweet to them and stuff like that. And so like I just went and had to get like one of the latest shots, and like the lady was super nice, and I just switched doctors, and so mom was like, okay, make sure you're extra extra nice because you never know what kind of day they're having. And I was like, okay.
Well, I think, JJ, what happens is an individual issue. Let's say our perception was that the patient was a little, geez, they were tough with the nurses or tough with you. that one thing you might say, well, that could have been better from their perspective. But as you just said, the whole day may have been that.
Hmm.
And at some point it's wearing you as the provider down. But those are just the bad days. All the good days make it worth it.
Well, thank you. I enjoyed this and I liked learning more about it and like learning more about you because like I see you all the time like at tournaments, but like I never knew any of this stuff. So it's really cool to know that. And
Well, thank you.
there is an evaluation form that I will send you and you have to fill it out. It's like maybe like less than 10 questions. It'll take you like 2 minutes to do.
Okay.
But I'll send that after we're done.
JJ, good luck with your project, and I can't wait to see you this season.
I
Cheers.
know. I'm excited. Hopefully we have a season.
Yeah.
Fingers crossed.
Yeah. Thanks a lot.
Well, thank you.